This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
And joining us today are DHS Deputy Secretary Julie Willems Van Dijk and Dr. Stephanie Schauer, Immunization Program Manager in the Division of Public Health. We will begin today's briefing with remarks from Deputy Secretary Julie Willems Van Dijk.
Good afternoon, and thank you once again for joining us today. Wisconsin is in a crisis, as you've heard us saying. Cases are high and rising. Hospitalizations are high and rising, and COVID-19 deaths are high and rising. And we all need to do everything we can do to prevent further infection today and in the future. We need to take those steps as individuals, and we need to take these steps as a state. For each of us, that means staying home, washing our hands, wearing a mask, and physically distancing when we go out for the essentials. For us at DHS, it means making sure you have the most accurate information possible about the reality of COVID-19 in our state and how to keep yourself and your family safe. It also means planning for future actions, and that is what we are here to talk about in this briefing. Specifically, our plans for COVID-19 vaccine distribution. As you've probably seen in the news, COVID-19 vaccine trials are showing progress, and we're anticipating that vaccine manufacturers will soon put in applications to the FDA for emergency use authorization. EUA is a process used during a declared emergency like the COVID-19 pandemic to make a treatment or a vaccine available more quickly. To qualify for the EUA COVID-19 vaccine, we'll need to meet safety and efficacy standards, and it will also be closely monitored throughout its dissemination. In a moment, I'll turn this briefing over to Dr. Stephanie Schauer, who co-leads our vaccine response on the COVID-19 response team. And she'll provide some more detail on what the process will look like in Wisconsin. But before I do that, I want to make sure we all understand the magnitude of this undertaking. In 2006, I was the health officer in Marathon County, and we spent over a year collaborating with neighboring counties and tribal health organizations to develop a pandemic preparedness plan. Part of that plan included practicing mass vaccinations. Since that time, local, tribal, and local health departments and their community partners have continued mass vaccination planning and exercising to be prepared for a moment just like this. And to be candid, this COVID-19 vaccination planning and dissemination is even more complicated than we had ever imagined. It will be the most extraordinary public health intervention our state has ever undertaken. It poses significant challenges, such as the need for ultra cold storage and multiple vaccines from multiple manufacturers on different schedules. However, this is what public health gears up for, and we are building on what we know works. We are building on and expanding our existing vaccination networks, including working closely with our healthcare partners, and testing components of our COVID-19 delivery plans during our current seasonal flu vaccine rollout. Vaccines, vaccine distribution, and the importance of vaccines are not new. To prepare for a safe and effective COVID-19 vaccine, we will continue to build on our previous experiences, continue to refine our plans, and continue to keep you as informed as possible about that plan and our program. I'll now ask Dr. Schauer to share more information on the Wisconsin COVID-19 vaccine program.
Good afternoon, and thank you, Julie, for providing that context. My name is Dr. Stephanie Schauer, and I co-lead the vaccine response as part of the COVID-19 response team. I am also the immunization program manager here in the Division of Public Health, which means that I oversee the Wisconsin Immunization Registry and the Wisconsin Vaccines for Children and Vaccines for Adults programs. I have been working in the immunization program at DHS for over 12 years. And previously, I was with the Massachusetts Department of Public Health. And prior to that, a postdoctoral fellow at Harvard, and I received my degree from Boston University. Like Julie said, COVID-19 vaccination is a significant undertaking. And at the state level, we are working with both local and federal partners to ensure that we are ready when a safe and effective vaccine becomes available. One aspect of this work is building our vaccinator network and enrolling healthcare providers and pharmacies in our COVID-19 vaccine program. And this will provide training on storage and handling and administration of the vaccine once it's authorized. Now, because the initial vaccine supply will be limited, we need to administer it in phases before it becomes widely available. At first, we will prioritize healthcare providers and support staff, as well as long-term care staff. And as supply increases, we'll widen the criteria for the recommended vaccination to other essential workers and people at high risk for getting sick from COVID-19. It will take several months before vaccine supply will meet the public's demand. Part of our vaccine plan is to continue routine updates on those phases through briefings like this one. And we will also keep the information on our COVID-19 vaccine webpage updated. You can find that at dhs.wisconsin.gov/COVID-19/vaccine.htm. Before we take questions, I do want to reiterate that while we are looking forward to having safe and effective vaccine in the upcoming months, we still need to continue taking steps to protect ourselves, our families, and our communities, both now and when the vaccine becomes available. Stay home, wash your hands, wear a mask, and physically distance if you do have to go out. And I'll add one more. Please get your flu vaccine. The flu shot doesn't protect you against COVID-19, but by protecting you from influenza, it can prevent you from needing care for the flu and help alleviate the strain on our healthcare systems. Thank you.
Thank you. Thank you, Dr. Schauer. Thank you, Deputy Secretary. And we will now take your questions. A reminder to maintain audio quality, please remain muted until it's time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and unmute. And we will begin with Stephanie Hoff from WisPolitics. Stephanie.
Hi, thanks for taking my call today. Do you guys have a time frame for when Wisconsin will receive its share of COVID-19 vaccine doses?
Well, Stephanie, we know that's going to be dependent on the steps in when the manufacturers apply for an EUA, the evaluation process, and then shipment. But Dr. Schauer, do you have a sense of how that might transpire in our state, given the information we've heard from the manufacturers?
Yeah, so we have been told by our federal partners to expect vaccine before the end of 2020. But I do want to reiterate that this is going to be rolled out and that the amount is going to be limited in scope, and we will continue to see that build over the upcoming months. So we are expecting by the end of 2020. But as Julie said, there's many steps involved before we get to that point. And one is really having an approved vaccine.
All right, the next question to Raquel Rubin from Politico. Raquel. And a reminder, *6 will mute and unmute your phone. Raquel, are you on the line?
Hi, sorry, I guess I wasn't unmuted. Can you hear me?
Yes.
Yes, we can hear you.
Great. Thanks so much. Thanks for taking my question. I wanted to reach out on the funding aspect. I know CDC had given states some money out of $200 million. I wanted to see, one, what you guys have used that money for, and two, is that enough, or are you guys seeking more, and how much, and what would you need more money specifically to build up?
Sure, I can begin that, and then I know Dr. Schauer can give you more detail about how we've spent the money. So of that money, Wisconsin has received $3.1 million, and we have been using it to prepare, and we'll be using more of it to support the people who will actually be doing the vaccine efforts in the future. As many of you have also read, CDC has estimated it would take $5.5 to $6 billion to effectively distribute this vaccine. And we agree that the state of Wisconsin will need more than 3.1 million to get millions of doses of this vaccine into the arms of everyone in the state who needs it. And so, Dr. Schauer, can you talk a little bit about how we've used this initial money?
Certainly. So some of the funds have gone towards helping to support local and tribal health as they gear up to provide immunizations. Some of the funds have been used to help bolster up the Wisconsin Immunization Registry. This is a key tool for this whole, the rollout of the campaign, and making sure that we have that system ready to go and that it does what it needs to do in terms of reporting doses and recording immunization doses and providing reporting to folks that are needed. And then we also are using funds to go ahead and provide some mass vaccination services to help augment local efforts.
Thank you for that. The next question, Rob Sussman, WTAQ in Green Bay. Rob.
Hi, can you hear me?
Yes.
Oh, okay. Sorry about that. My phone was messing up. My question is in regards to what people can expect once the vaccines start rolling out. In what method do you think that these are going to be distributed? I mean, are we going to see kind of like drive-through vaccination sites at some point, or is this stuff that it's going to be primarily done, one-on-one maybe with one's PCP or something like that?
Well, Rob, I'd say all of the above. As we said, this is a massive vaccination effort, and we're going to need all hands on deck in order to get as many people in Wisconsin immunized as who want to be immunized. So a couple of the methods that I know we will be using, remember again, in the first phase, we will be have fairly small amounts of vaccine, and they will be going to very targeted groups. And so in that first phase, we'll be likely focusing on frontline healthcare providers. So vaccines will likely be given through employee health in hospitals or in nursing homes or in other places where healthcare workers work. We also know that in that early phase, we will be likely focusing vaccine on people who live in long-term care facilities, skilled nursing homes. And so vaccine will be delivered there, likely through pharmacies. You may have heard the federal government has executed contracts with CVS and Walgreens to assist with making sure we can quickly vaccinate people in long-term care facilities. And then as vaccine supply builds, we'll be moving into other settings across the state. Just like with our testing program, where well over half of our tests have been done by practitioners in the healthcare system, we anticipate many, many, many vaccines will be given by going to your primary care provider and getting that vaccine in your own health system. But we will also make sure that there is a system of community-based clinics that people can go to access vaccine. Again, building on what we've learned through our community-based testing system. We haven't yet made the plans for that phase to know if there'll be drive-through clinics or walk-up clinics or a combination of those. But again, making this vaccine widely accessible to people is our goal as we move through those phases. But again, I want to caution patients. It will start small and it will grow over time.
All right, we go now to Madeline Anderson at Fox 6 in Milwaukee. Madeline.
Hi, just kind of following up on the previous question. Do you know exactly how many people you're talking in that first phase that includes the frontline healthcare workers, the people in long-term care facilities, the other essential workers?
Dr. Schauer, do you have an estimate of that number?
Yeah. So that definition does change a little bit depending on how expansive the number is. I can safely say that the number will greatly outweigh the number of doses that we receive in the beginning. So it will take some time for us to be able to vaccinate all of the healthcare workers to start with. And then, as Julie said, we will go from there and expand and go into the subsequent phases and larger groups. But it is anticipated that it will take a bit of time to get through those healthcare workers, and somewhere on the order of several 100,000, give or take, depending on how you define what a healthcare worker is and who fits into that definition.
Thank you for that. The next question to Gabriella Primus, WLUK in Green Bay. Gabriella.
Hello. So stadiums like Miller Park are being used for COVID testing sites. Could that transition to vaccination sites? If so, what about stadiums like here in Northeast Wisconsin, such as Lambeau Field or Rest Center? Would they be used as vaccination sites?
Those are all possibilities, but you've raised a really important point that I want to make, which is we need to be really thoughtful about this and understand that we will still, in all likelihood, be running a testing site at Miller Park at the same time we're starting to do vaccination. It's really important to understand that we will need to continue to do everything we're doing now to protect and control the spread of the disease, protect people against infection, and control the spread of COVID-19 while we are beginning vaccination. It isn't like one ends and the other starts. They're going to be running concurrently. So we do need to think thoughtfully about how we continue to run testing while we are also standing up immunizations. Because let's think about this. First of all, on day one, we're not going to have 5.8 million people vaccinated, right? It's going to take a number of months for us to get everyone in the state who desires to have this vaccine vaccinated. Number two, the vaccine is a 2-dose vaccine series. So you need to have both of your doses in order to have immunity conferred. And so there's going to be a period of time between those doses. And so even from the day we start until the day we finish, which will be a number of months, we all need to continue to wear our masks, keep socially distanced, keep our gatherings small, wash our hands, and definitely stay home if you're sick and get tested. So it'll be important for us to remember that we'll be doing both sets of activities at the same time. Anything you would add, Dr. Schauer?
No, not for me. Thank you.
All right. Thank you both for that. The next question will belong to Danny Maxwell, WKOW in Madison. Danny Maxwell. All right, we'll try to get back to Danny. Let's go to Jessica Van Edgeren, Up North News. Jessica, Up North News.
Hi, I'm Christina Leffering with Up North News. Jessica wasn't available right now. My question is, my understanding is that states already know how many doses of the vaccine they're going to receive within this first round. Do we know how many Wisconsin is set to receive?
Dr. Schauer?
Yeah. So we do have different numbers from CDC as planning scenarios, but we don't have a definitive answer at this point. And so we are certainly working through different numbers, but we have not been given that. When we are allocated vaccine, it will be based on population. So the state of Wisconsin's population will figure into the number of doses that we will be allocated to begin with.
All right, thank you. Next question, Scott Bauer, Associated Press. Scott Bauer. A reminder, *6 will mute and unmute your phone. Scott Bauer. All right, I hear clicking. We'll try to get back to Scott, and let's go to Katie Thorson, WXPR in Rhinelander. Katie.
Hi, thanks for taking the time today. I am curious to know if you guys foresee any challenges or major differences in rolling out the vaccine in rural areas compared to more urban areas of the state.
That's a great question, Katie. And, you know, as many people have heard, some of the vaccines are going to require this very uber cold storage situation, which could create challenges moving the vaccine around the state. But the good news is that not all of the vaccines are going to require that cold of storage. And we're really excited to hear that not only Pfizer, but Moderna is very close to filing for their EUA. And we know there are other vaccines in the pipeline, again, with varying storage requirements. So we're really confident that with the array of vaccines that we'll have an opportunity to get vaccine across the state. Our testing program, again, that we are going to model much of our vaccine program after, has touched all corners of this state. And we are fully committed to making sure no matter where you live in Wisconsin, you will have access to this vaccine. So there may be some logistical challenges with some of the vaccine product, but we're confident with the variety that we'll be receiving that we'll be able to overcome those challenges and make sure we are able to get vaccine to people in rural parts of the state.
All right, we go now to Sean Kirkby, Wisconsin Health News. Sean Kirkby, are you on the call?
Hi, thanks for holding this. I was wondering, could you guys talk a little bit more about what you're doing around the uber cold storage that you're going to need for some of these vaccines? Like, how do you plan to handle that? Thank you.
Well, first of all, we're finding where the freezers are. That's the first thing we're doing. And then, Dr. Schauer, what else would you like to add to that?
Yeah, I think that's important to know which entities can go ahead and store it and using those as certainly key pieces in it. But I think it's important to remember that this vaccine does have some limited storage capabilities if you don't have that -80. And so with a refresh of dry ice, it can stay up to 15 days. And in the refrigerator, it needs to be used within 120 hours. Those are still pretty short time frames. But with planning, it is possible for entities that don't have that -80 storage to still be able to receive and administer that vaccine. Just requires a bit more planning to ensure that all the doses can be used in that time frame.
And one of the things I'd like to add to that is that Wisconsin manufacturers of dry ice are very aware of this and have been in touch with us and are working closely with us. And so I think it's a great example of public-private partnership and how people across the state are coming together to assure that together we have everything we need to be able to get this vaccine to all parts of the state.
All right, and the next question now to Denise Lockwood, Racine County I. Denise Lockwood.
Hi, my question is around like the expectation around participation. What percentage of the community or the state would you like to see being vaccinated, and what are the potential outcomes of that?
Well, let me start being the hopeful Susie Sunshine here and say that I hope 100% of the state sees this as a great opportunity to put an end to COVID-19 and to protect themselves. And I know that is not always possible with any vaccine. And so let me turn to Dr. Schauer to talk a little bit more about our goals and what would achieve viable herd immunity here.
Yeah, and I think we're still learning about what is that magic number. I don't think that we have that yet. Certainly, we know that we want a fair number of people immunized, and more that is better than less. And so I don't have the exact number for the goal. I know when we talk about planning for pandemic influenza, for example, we were looking at 80%. And I think given the nature of this, it's somewhere in that ballpark. And we can get you the exact number that the federal government has certainly put forward. But I think it's a lofty goal nevertheless. If you look at influenza vaccination, last year we were at 42%, and we know we definitely need to do better. And so I would just take the opportunity to pivot and just say, one thing that we can encourage folks to do right now is make sure that they've gotten their influenza vaccine if they haven't already. It's truly important to make sure that we are protecting ourselves against influenza in addition. So thank you.
Thank you. Nick Bohr, WISN in Milwaukee. Nick.
Good afternoon. I had a question about the vaccine options. I mean, you could have numerous ones. I guess maybe we hope we do have numerous ones. Does part of your planning include which vaccine might work best for which population? I know some vaccines work better with children, some work better with elderly people in general. Is that part of your planning, that you have to think about the logistics of that, given that everyone has to get the same vaccine that they got the first time, the second time?
Yes, and let me just emphasize that point that you just made so that people are aware of this. What we know is with multiple different manufacturers is that you must receive your first dose and your second dose for the 2-dose series from the same manufacturer. And we also know each manufacturer has their own schedule. So it may be 21 days apart or it may be 28 days apart. I think we're still learning about each of the vaccines and who they've been tested on and their efficacy panels. Dr. Schauer, what more would you say about targeting certain vaccines to certain groups and what we know at this point in time?
Yeah, I think it is certainly a challenge right now. The two pieces of information that we've been given is they're both in the ballpark in the somewhere, upwards of 90%. That certainly needs to bear out as it goes forward for review and approval. But yes, that certainly is a possibility that down the road we may have a vaccine that may work better, and that would certainly need to factor into the allocation and planning. Right now, we don't really have those numbers in hand, and we still await them supplying that information to the FDA, and then really looking towards the Advisory Committee on Immunization Practices, or ACIP, that will review the data and make recommendations. And that's where we would see if there were certain age-based or other clinical indications where one vaccine might be preferred over another.
Thank you for that. We go now to Eric Gunn at the Wisconsin Examiner. Eric Gunn.
Hi, thank you for including me in this call. There are surveys that suggest that some segment of the population will turn down the vaccine for various reasons. How do you anticipate trying to address those people and their worldview, if you will, and what kind of public education planning are you doing in order to ensure that the people who need this get this?
Well, that's a great question and something we're very concerned about and focusing on at this time, Eric. So thank you for that question. We've also seen the surveys and understand there is some hesitancy on parts of the population about this vaccine, and the reasons for that vary. We know certainly that one concern many people have is, will this vaccine be safe? I think sometimes when something is developed quickly, people wonder about how much attention was paid to safety. One of the things that I think is very important for people to understand is that the FDA and their scientists will look at all of the data themselves. They will not count on the analyses from the pharmaceutical companies. They will ask for all of the raw data, and they will do analyses based on safety and side effects that vaccine participants may have experienced, as well as the efficacy of that, of the vaccines that have been described. So it will be an independent review by scientists who are charged with this as their public service. In addition, as with any medication, once it goes from trial into broad general dissemination, we'll continue to monitor for safety. And if there are any safety concerns, those will be addressed immediately upon their identification. We have a very robust safety monitoring system for all vaccines in the United States, and that system will be in place for this one as well. So I think that's a big portion of what people are concerned about. I think the other thing is people are worried about the unknown. This is a new vaccine and you don't know. And so I heard Dr. Anthony Fauci speak to this earlier today, saying that as people get the vaccine and, assuming it is safe and people are experiencing relatively few side effects and are reaping the benefits of the protective effects of the vaccine, we think support for the vaccine will grow over time. And so that's another important factor. Some people, are the first ones to raise their hands and let me be first in line. And other people with any kind of change want to wait and see and come in the second or third wave. In terms of public education and what we're doing, let me turn to Dr. Schauer and see what else she would add in that regard.
Sure, thank you. And I think you hit it key on the head, is that the education and communication is really important. We have plans in place to make sure that no matter if you're a member of the general public or you're a healthcare worker or a stakeholder, that you have questions about the vaccines, about the safety, about the efficacy, that you get those answered. And this is true for vaccines in general. It's important that people have the information that they need to make an informed choice, and that they feel comfortable with that choice to move forward and be vaccinated. So we do have a number of different communication streams trying to provide information to folks well ahead of the time when they may receive vaccines, so that they can get those questions answered in a timely manner and really feel confident about that decision.
Right. Thank you so much for that. We go now to Austin Montgomery, Beloit Daily News. Austin Montgomery.
Hi, can you hear me?
Yes, we can hear you.
All right. Could you explain the chain of custody on how the vaccine would be distributed from the state to local municipalities with all those complications for cold storage and things like that? Just walk me through that chain of custody, please.
You bet. Dr. Schauer?
Sure. So the system that we will be using to distribute vaccine is one that we are using day in and day out, that with a sort of a link with the Wisconsin Immunization Registry linked into healthcare providers, and that system also being linked to CDC, is we use and distribute nearly $50 million worth of vaccine for the Vaccines for Children program every year. And so how that entails is that an order for a particular provider will be placed in the Wisconsin Immunization Registry. That information is sent to CDC, which would then send the number of doses and where it's supposed to go to either the manufacturer or the distributor, depending on where the vaccine will be coming from. They then will ship that vaccine directly to that end user, to that vaccinator. So Wisconsin will not be receiving the vaccine in terms of the state, but it will actually go directly to that end user as we typically do day in and day out. So hopefully that answers the question about it's really building on an infrastructure that has been used and tried and tested.
Okay, the next question to Bridget Bowden, Wisconsin Public Radio. Bridget.
Hi, yes, thank you. I'm wondering for people who won't be receiving a vaccine from their employer, but are still fairly high up on the priority list, say if they're elderly or have some sort of medical condition that makes them high risk, how will those people know when a dose of the vaccine is available for them? Will they be contacted by someone? How's that informing process going to work?
Well, certainly one mechanism that will be working is public information, such as we're doing here today. We'll be keeping people up to date and up to speed about who is now eligible for vaccine and where the options are for obtaining that vaccine. I would anticipate that healthcare providers, with the strong use of MyChart and other notification mechanisms, may very well be putting plans in place for as they receive vaccine to be looking at their patient profiles and sending out messages encouraging them to make appointments for those services. Dr. Schauer, what else would you add?
Yeah, no, I think that's key, that there will be many different ways of ensuring that people are aware of when it is their time to receive vaccine. And as Julie said, there may be a number of different venues that they can receive that, and all of these methods will be important. One thing I would like to highlight is that we've talked about the second dose, and the Wisconsin Immunization Registry does have a portal where individuals can look up their own immunization record, and this will include the COVID-19 vaccine. So they will be able to determine which vaccine they had and when they need to return for that second dose. So I just want to highlight that not only are we thinking about how healthcare entities can go ahead and remind folks that they need that second dose, but also that individuals have that information at their fingertips.
Good information. Thank you both on that one. We go now to Brittany Schmidt, Action 2 in Green Bay. Brittany Schmidt.
Hi, I would like to ask, so I know that you talked a little bit about the vaccine distribution. Do you know if kids were involved in those studies, and will kids be able to get one of these vaccines that was part of the trial? And then my second part of the question is, I know you talked about storage for these vaccines, but are you advising right now rural areas to get freezers for that cold storage?
Dr. Schauer, you want to take those questions?
Sure. We are not advising, and CDC is not advising that entities purchase the -80 freezers. As we said earlier, that there are other options for those without the -80, and we do anticipate that in terms of approval of vaccine, that the Moderna vaccine, which has far less stringent storage requirements, will come fairly close on the heels of the Pfizer vaccine. And so given that information about the other options and additional vaccines with different storage requirements, it is not recommended that they purchase those. And then we are looking into entities in each region and areas that have that -80 storage capacity. With respect to the question about children, in these first clinical trials, I believe children were not included. But now that they are through the sort of first initial phases, the manufacturers certainly recognize that there are gaps, and that would be children, pregnant women, and immunocompromised individuals. And now they will go back and go ahead and collect data to go ahead and put that forward But in this initial, the vaccines will just be, I think the EUA applications will just be for adults.
Okay, thank you so much for that. Our next question, David Wahlberg, Wisconsin State Journal. David Wahlberg.
Yeah, thank you. I was wondering how much more money than the $3.1 million does the state believe it's going to need to pull this off? And then I know you don't know exactly how many doses you might get initially of the vaccine, but given that the two manufacturers have said roughly 20 million of each vaccine might be available late this year or early next year, if those numbers come along, what would Wisconsin's likely share of those doses be?
Well, in terms of the question about cost and how much exactly we'll need, David, I think it's a combination of things. Part of what we are exploring right now is we're preparing to work on contracting for a vendor to assist with vaccine administration. And we want to maximize third-party billing. And so we'll be working on the mix of funding to support this effort. We know that the vaccine itself will be provided free of charge to the state and to people to entities who are vaccinating, but the cost of actually conducting the administration of the vaccine for the personnel and the supplies to do that we are still estimating what portion of that will be covered by third-party reimbursement and what portion of that we'll need to secure. So those analyses are currently underway. And the second part of your question,
I can take that.
Okay, great.
The question was, what would Wisconsin's allocation be?
Oh, right.
If they are using the funding percentage the allocation percentage regarding population, Wisconsin's is about 1.77% of whatever would be available nationally.
Thank you for that. And the next question to Naomi Knowles of News 3 in Madison. Naomi Knowles.
Hi, yes, this is News 3. This is Amanda. So my question is, I know a lot of people are excited about, getting back to normal soon, but the reality sounds like that's still going to be a long time before we have herd immunity and before enough people are vaccinated that we have this new normal. Are we thinking into 2022? What is really the timeline on getting back to our lives?
Yeah, that's a great question. And I wish I had my crystal clear crystal ball to be able to give you a precise answer to that. And we are still working on, let's remember, no one has yet submitted an application to the FDA. So we're working off best case scenarios from the manufacturers and from our federal partners to even be thinking we'll be doing vaccine by early January. We are really hopeful about that because we all want to get back to our normal lives as well, too. But we also want to do it in a way that it's safe, that's of utmost concern, and understanding that it will be a process that, as we've mentioned, will need to ramp up from a few to a few more to many to lots, and that ramp up will happen over several months. In listening to some of our federal partners, such as Dr. Fauci, he is predicting that by later 2021, we should be in fairly good shape if we have if the vaccine truly turns out to be as effective as the initial reports indicated, if we're able to produce the vaccine, if we're able to get good uptake of the vaccine, all of these things will help contribute to creating a level of immunity that will protect us and that we will return to life more normal than we are accustomed to. I think this pandemic, however, will change us forever in thinking about infection control and thinking about many of the protective elements that we've taken, maybe very smart things to do throughout our lives. I mean, I hope we're all much better at washing our hands and thinking about how close we have to be to people, and even perhaps wearing facial coverings when we're out in public, particularly during cold and flu season, about getting our vaccines regularly. So I think many of the practices that we've started during COVID-19 could serve us well, but certainly the opportunity to socialize, to be together, to be able to be in larger groups again is something that we're all looking forward to very much and are hopeful that we will be there sometime in later 2021.
And the next question goes to Mary Jo Ola, WTMJ in Milwaukee. Mary Jo, TMJ4.
Hi, thanks for doing this call today. I just kind of wanted to probe a little bit about the timeline, which I understand is dependent on a lot of things, but can you speak broadly to the time frame as to when people who are not healthcare frontline workers or kind of in that higher tier of more vulnerable population, when can people who are not part of that expect to have the vaccine available? Can they expect like about 3 months from when it starts with that priority group, or more?
Dr. Schauer, you want to comment on what you're anticipating or hearing from our partners?
Yeah, and I think, as you said, it's dependent on so many different variables and how much vaccine we get initially to really be able to vaccinate that first group of healthcare workers, and then after that group, then it would be, as you mentioned, the individuals who are 65 and older, other essential workers, individuals in long-term care, and we're hoping that is sometime in the spring, but there's a wide berth on that, and it's really dependent on a number of different factors that are out of our control. And the first thing, as I said, there's so many steps to get to that point, and it starts with we need the manufacturers, when they are ready, to go ahead and submit that information to the FDA for their review and then approval, and then continuing down. So lots of steps before that, but that's sort of a ballpark guess.
Okay, and the next question belongs to Christine Flores, CBS 58 in Milwaukee. Christine.
Hey guys, thank you so much for taking this. So can you guys talk a little bit more about the role that pharmacies and hospitals are playing when it comes to preparing for this potential rollout plan for the vaccine once it's available?
We most certainly can. We really want to acknowledge again, as we have seen with testing, our healthcare partners are critical partners in this response, and we know they will be in this portion of the response in terms of vaccination. So, Dr. Schauer, would you like to talk about pharmacies and healthcare and both what they've done in the past with influenza and what we're anticipating with COVID-19?
Sure. They're both are such crucial partners. We know that pharmacies in particular provide much of the flu vaccine, particularly to the 65 and older population. And so feel that they will really be valuable assets, particularly in phases 2 and 3, where it's moving more towards the more general populations and out of these limited groups. I will say that the pharmacies are also going to be engaged in vaccinating those individuals at long-term care facilities, which is earlier in the rollout of the vaccine, and that they will be providing vaccine to any of the long-term care facilities who have signed up for that service. That's a CDC program that helps partner up one of those facilities with either a CVS or Walgreens. And so it takes all of the planning and the administration out of that facility's hands and puts it into pharmacies who are used to doing this. So that's one key place where pharmacies will be working. In addition, we're hoping and anticipating healthcare facilities will be involved in vaccinating their own healthcare workers, and then thinking about how they can move forward and participate in phases beyond that. And as we said, certainly one of the options as we get further into phases 2 and 3, where the general populations will be advised to receive vaccine, that they will be an important piece in that, is going to your primary healthcare or perhaps a community clinic or perhaps a pharmacy. So I think all of these partners have roles to play at different periods throughout the campaign.
Thank you. And the next question belongs to Marty Mickelson from WUWM in Milwaukee. Marty Mickelson. A reminder, *6 will mute and unmute your phone. Marty Mickelson. All right, why don't we move on and try Emily Davies, WSAW in Wausau. Emily, are you on the call?
I am. Thank you so much for taking the call. And I have a ton of questions, but I will keep it brief. I wanted to see if, knowing that these vaccines are going to be taking 2 doses and that we're going to be getting a limited supply, and I believe, Dr. Schauer, I was on your public meeting last week saying that the vaccines are not supposed to be held for that second dose. Are you concerned at all that those doses, you won't have enough dose allocation for people to get that second round where they might miss that in the window that they're supposed to get it?
Yeah, no, so that is a good question. So CDC will be holding half of the allocation so that individuals who receive the first dose, that we will have the second dose waiting for their provider. So there is a mindfulness that a complete series is needed for protection, and that folks who get their first dose can be reassured that there will be a second dose waiting. With respect to the minimum intervals, many of them are either 21 or 28 days that we're hearing. And just a reminder that that is the minimum, that it doesn't have to be right at day 28 or day 21, depending on the vaccine, but that is the minimum. So there is a little bit of wiggle room there, and people won't sort of miss a window for a second dose, but rather it'll be important that they get that in the right time frame or when they are eligible, but people won't sort of be bypassed if they don't get their vaccine right on day 28. All right, thank you so much for that. We go now to Natalie Sopala from WAOW in Wausau. Natalie.
Hi, thank you. My questions were all answered.
Wonderful. Thank you. We will move on to Mark Johnson, Milwaukee Journal Sentinel. Mark Johnson. A reminder, *6 will mute and unmute your phone. Mark Johnson with the Milwaukee Journal Sentinel.
Can you hear me?
Yes, we can hear you now. Thank you.
Okay, great.
Yes, we can hear you.
2 things. One, I wanted to check whether in that first group of people, you mentioned healthcare workers, people at long-term care facilities, will it also include all people over 65 and over, or are those going to be in the second? Are people who live independently and are 65 and older going to be in sort of a later wave?
That is what we anticipate at this time, Mark, is that they would be in a later wave. We should reiterate that the phases that we're talking about and the groups we're talking about are what we anticipate. The final decisions on all of those groups will be made once a vaccine is actually approved by the Advisory Committee on Immunization Practice. So we are speaking to the likely candidates for these groups based on the discussion and publications from a variety of parties to date.
Right. Thank you for that. We will now try to go back to Danny Maxwell at WKOW in Madison. Danny Maxwell, are you on the call? And Scott Bauer, the Associated Press. Scott Bauer, are you with us?
Hi, thanks for coming back. Just real quick, what advice do you give people who are wondering, to follow up on Mark's question, who are wondering, will I be in that first round or later round, or where do I fall? What should those folks do as they're trying to figure out where they may make it vaccinated?
Well, I'll invite Dr. Schauer, but my initial response to that would be stay tuned. Keep watching the news, reading the news, visiting the DHS website, and we will keep people up to date as those decisions are made. And secondly, in the meantime, keep doing what you're doing now. Stay home unless you need to go out for essential business. When you do go out, socially distance, wear a mask, wash your hands. If you are in one of those higher risk groups, particularly people over 65 and particularly people over 65 with other health conditions that put you at greater risk, really consider if you can order your groceries or have somebody else pick up your groceries so you can minimize those trips out of your house. And if you are sick, call your healthcare provider, get tested so appropriate action can be taken. So we will continue to update our website. Our plan is to do regular media briefings on this to keep people up to date so they know where we are as we step through these phases moving forward. And there will be extensive public information available. And as we know more, we will stand up further communication assets so that the public can know more as well.
Thank you for that. And we will try now to go back to Marty Michelson, WUWM in Milwaukee. Marty. All right. Well, no, Marty, and that concludes today's briefing. Thank you, Deputy Secretary. Thank you, Dr. Schauer. Thanks to all of you for participating. And of course, we want you to continue to monitor the DHS COVID-19 web pages for data and for guidance. And you can find additional information on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.